gave you a dirty look last time.
I don't know why I do this.
You want the far seat thing?
No, I'm just gonna leave it there. Just gonna let it go.
You just have to click start, right?
Yep. Actually, I'm starting it now, and I'll just cut off the phone.
You can't install a door in that?
Huh?
There's no door in that. Cut out, Fred.
That's a step above what was there.
I know, I'm joking with you. I mean, it's framed and everything.
Yeah, so I've been telling Andrew that I'm going to open up a hospital. He's busy today.
Was he? I saw a lot of activity around the base.
Am I in trouble? No, no, no. Just check. No, not at all. Just want to be prepared if I am. Okay. I feel better now.
Is that a guilty conscience?
I've always said guilty conscience.
There's a long list of things I could be guilty for in virtually every place.
Can you do it? Fire me up.
Were you because you passed by? I have to chat with EJ. You know, he's got a reservation, but I will. You're gonna hang out. Okay. Am I in trouble? Then okay, good.
I can't text him the song.
That's awesome.
We'll call the meeting to order. Thank you everyone for coming. Has everyone had a chance to review the minutes from the last meeting? If so, a motion to approve or any amendments? Second to the motion? All those in favor? Opposed? Excused tonight are PJ Keeler and Aiden O'Connor. No enforcement notifications for this month. Correspondence are listed there. They're available up here for anyone who would like to read them. There's 2 course applications for renewal there. Then we'll move on to the CON committee.
The CON committee met tonight. We're in receipt of the application for the town of Greenfield to convert their municipal operating certificate to a permanent certificate. And we've still had 3 questions open, so we referred it back as incomplete and await further notice.
Excellent, thank you, sir. Any questions for Jim? Okay, seeing none, we'll move on. Executive Director's report.
Hopefully everybody has a copy. Not a lot on there. One thing was the awards banquet, for those of you that were there. It was a great night. Delicious food. The recipients were very happy and very grateful, though we did have about 90-something people RSVP and approximately 60 people walk through the door. But that just meant there was more food for everyone else. But all in all, it was a very good night.
Any questions for Tim?
One other
Sorry,
thing,
no, go
just, no, I'm sorry. One other thing, I'd like to welcome, and I don't recognize him, Ernest Skip Beverness. I don't know if Skip is here tonight from Rensselaer County. He's a brand new appointment to your membership, to your body.
His name is Skip Beavernitz. His given name is Ernest, but everybody just calls
Skip.
him Skip.
Okay, well, hopefully next meeting we'll get to welcome Skip. That's about it. If anybody else has any questions on the rest of this, be happy to answer them.
Any questions or comments for Tim? Treasurer's report. Tim, would you mind going over that, please?
Nope, we're in very good shape. One item of note, if you look at accounts receivable, New York State course reimbursements. That line item was approximately $11,000 and change last year, and we were under the notion that we had some outstanding vouchers from DOH. Rich went back and met with DOH. That actually wasn't money owed us. We vouchered for some students that either did not pass exams or were unvouchable based on the fact that they were not affiliated with agencies. So that number has been erased. They've reconciled that, and we are square right as of today with DOH regarding training receivables. Other than that, we're in great shape.
Any other questions or comments on the financial report? Okay, second motion to accept this report from the executive board. All those in favor?
Aye.
Opposed? Finance report?
The only thing from Finance Committee is that the Executive Director has calculated in 2015 incentive compensation based on the formula that is in force, and we discussed it at the Executive Board and want to move that forward. Also discussed that there needs to be a new formula for 2016 and that we will have it ready by February.
Any questions for Steve? Medical Director, Mac, Academic.
Couple of things of note. The first thing I'd like to let everybody know that the Mission Lifeline project is going to be kicking off on December 1st. Already had the hospitals working hard to begin to collect data, and I've been getting a number of requests from some of the data collection folks to make sure they're collecting the right stuff. So if you get any requests from any of the hospitals for pre-hospital data, say thank you, because it's exciting they're actually focusing on what's happening before the patient gets to them. We'll also be releasing a QI rubric basically for each of the agencies. Goal being arrival to EKG time, quality of that initial 12-lead EKG, making sure there's a name on that initial 12-lead EKG. Basically, the things we should be doing to assure that we are working at the appropriate level with electrocardiogram receipt. We'll cover a little later, but we also are in the process of spending a significant amount of time working with the hospitals to get money to replace the modems across the system. That process is advancing well. My partners on this project include Matt Miles from Ellis and Sam Bosco from St. Pete's, who are being fantastic in terms of helping get this ask, if you will, correct. We hope to be able to do this successfully. That'll come up later during the...
You want to do it right now?
Sure.
Bring it up.
Okay. One of the things that I had mentioned is that we asked the Heart Association whether or not in the Mission Lifeline grant there might not be the ability to provide us with some seed money to assist with the purchase of the modems that we needed to replace. Since this was a project that Physio Control basically gave us 6 months to accomplish, which isn't reasonable in anybody's budget schedule. The Heart Association both pleased and surprised me by agreeing that they might actually find $10,000 in the process to be able to assist us, which is very exciting, because that was our first collection towards our goal of 100,000. I approached the executive committee and asked if we couldn't have some assistance from Remo as well. So we have regional funds assisting with the process too. And the executive committee was forthcoming and very helpful with the idea that we should seed that process. I believe a motion was made and seconded there and comes forward as a grant of $15,000 for the process of replacing the modems across the system.
Comments, questions from anyone about the second motion?
We're gonna have, is this just gonna be the modems that exist now, or is it gonna expand into two more?
This ask was for replacing the modems that already exist, not ones that should have been purchased as part of any additional equipment that is bought along the way.
Okay. What
The
about
purchase price, I'm sure, of those modems, we would allow to be open
that was my next
so
question.
that we would negotiate a price based on our purchasing power of how many modems is it, Tim, 100?
It's over 100.
A lot of modems. That purchase price would also be available for anybody else.
Like a piggyback?
Mhm.
Thanks.
Any other questions or comments? All those in favor of the motion?
Aye.
Opposed? Motion carries.
Thank you. Among the other things that were important, we talked about at the MAC, that we talked about here, I believe, before, but all of the PLSFR agencies were notified by New York State that their certifications had expired. Certainly are working through our contracted agencies to try to get that resurrected and fixed so people can continue to take New York State courses. That process is certainly a lot more work than I would have appreciated. Unfortunately, it did occur. Anything else to add, Miriam? You're here, so I'll call on you. Anything else to add for this?
PLSFRs, as long as they make contact with our office in the immediate future, they are willing to work with them. Either contact Joe Farrell or Dan Clayton. And they're willing to work with them. The letter basically said you're expired, but you have a month to get a hold of us until we make you expired. So I had nothing to do with the letter. I was the one that pushed to get a little more gentle, user-friendly letter.
We've actually noted that several times in conversations with them as well, so appreciate that.
The other thing is, I don't know if you want to bring up, if anyone has questions about the EpiPen, there is no waiver required from us to participate because of the, when the EpiPen material was distributed by Tim and others, I approached Lee and asked if a waiver would be required because you wouldn't be carrying the EpiPens. And the answer I gave is a typical Lee answer. Carry the EpiPens until they expire and then dispose of them accordingly. But do not remove that EpiPen funding from your line item until we're sure that everything has gone through 100%.
As soon as you participate in the syringe access EPI program, this is taking a step to the left. The syringe access EPI program, as you remember, was with custom syringes designed specifically to draw either 0.15 or 0.3 milliliters of epinephrine for use to replace the epinephrine auto-injectors. One of the things you have to agree to do is only have those kits on board your ambulances if you are going to participate. So what you would do is remove the EpiPens from your ambulances. The department points out that even if we have an 18-month period of time for the pilot project, it may very well be longer than that before this is accepted practice through the department, and we may have to go back to EpiPens at the end of this. We'll be working with the department to see if there's a way, given data that we can collect in the first 9 months, to speed that process up, and we'll keep everybody posted as we go. Dr. Cushman and I have had some long conversations about how that should actually progress. We'll have to wait and see. It would be a real shame for us to find a way to save the state of New York $10 million, that because of some administrative issues in terms of getting approvals, we can't continue to go forward. On the other hand, this project may not work, right? That's the reason it's a pilot, is so we can make sure that this works, but it's safe for our patients and it's safe for our providers. So let's see how we collect data over that first 9 months and what we bring back to the CMAC and to the commission. We have a lot of faith that this will work, but let's see. If we didn't think it would work, we wouldn't have brought it forth in the first place. Fair,
Yeah.
Mary?
I have a question about it though.
Yeah.
So after an agency does the application process, how do they get the product?
The product is actually going to be distributed through Monroe Livingston.
Oh, okay.
And Monroe Livingston is basically going to open a Boundary. Boundary is serving as our manufacturer, if you will.
The Boundary won't sell it yet.
What?
So you have to get through Monroe Livingston.
You have to get it through Monroe Livingston. They will open that gate once the authority is there.
So agencies apply to Monroe Livingston, or do they apply to their own?
They fill out that paperwork that has, went
Okay.
through that came out through the region.
But does
Does that help me?
the
Yeah.
paperwork go back to Remo and then to Monroe Livingston, or does it go
It
back?
actually goes straight to Monroe.
Okay.
Goes straight to Monroe.
I've asked for a copy of the app as well. so we
Right,
can
no,
keep
I know
on top of
that
it.
other Remscos have done the same thing.
It has to be signed by the chairman, though, your paperwork.
Which one is that?
This is for the auto, for the.
Right. The Remsco has to sign, or the REMAC has to sign off on it.
The REMAC has to sign off on the whole thing, yes. The REMAC has already signed off on the whole thing before we created the pilot.
We don't need to have it signed.
That needs to be signed once. That piece of paper was not supposed to go out to everybody. You have to do everything else, just not that one piece. That one went out thoroughly. Thank you for reading it, though. I appreciate it. You're the first one.
Hold that up.
Other things of note, unless there's anything else on syringe access epi. One is blood transfusion. We're working through, Albany Med to put together some educational materials that will be used by some of the agencies that will be transmitting, or most likely to transport blood transfusions. This is pretty exciting. We've certainly invoked the name Deb Funk with great thanks many times during our process here. We have not yet received our first patient with a hanging blood transfusion. We're looking forward to it coming soon. And then hopefully everybody has gone through the re-education process and has been updated with spinal immobilization and hemorrhage control. Hemorrhage control not being a protocol update, being informational only, and spinal immobilization being a protocol update as the BLS update. Amory has been great at disseminating this information through the nurses. We've been getting it to the docs. Please make sure that Tim knows if there's ever a problem with one of your agencies bringing a patient in with spinal motion restriction in place. However, no board. If we get any pushback from nursing or physicians in the emergency departments, we want to be able to re-educate them. Okay? That's really important. This is a slightly bumpy road, but it's getting there. It's getting there. I think that's it.
Thank you.
Thank you.
EMS Council, next meeting is in December. Nurses Committee?
Our next meeting is in November.
BJ's not here for MCI. Anything from membership, Lynn?
Excuse me?
Anything from the membership committee?
No, sir.
Thank you. Nominating committee, we don't have yet. QI committee?
Meet next week.
Awards already done. Albany County.
I attended the Albany County Legislature meeting on October 13th, which was in conflict with the email the other night. But at the meeting, they appointed a new county fire coordinator for Albany County, which is Jared Paris. So that's, offices have been vacant since January, so hopefully things will move along now.
Thank you. Anybody from Columbia County like to report anything? Okay. Greene County? No report. Rensselaer County?
We still have a couple of spots left in the pharmatic class.
Thank you for filling everyone in last week. It is Friday night, Saturday, Sunday, November 13th through 15th. It's dirt cheap this time, $65, all the meals included. Cooperative Extension has a grant that they're using towards it. It's a provider level class, so we do 8 hours of hands-on rescuing on Sunday, turning over tractors and cutting apart farm equipment.
It is a great course, and it's not necessarily just for farms, it could be even with some of the equipment.
So, if you're still interested, let me know.
Thank you.
Saratoga County, I have nothing to add. Mike, did? Schenectady County.
No report.
Thank you. Moving on to new business, Tim, would you like to present your budget, please?
Sure. Does everybody have a copy of the budget proposal? This budget, this year is a little different in that we're proposing to actually add some staff members here and spend a little bit of money operational wise. There were 4, or actually 5 proposals here, and I'd like to go over them individually with everybody. The first one is related to the QA/QI office. It's become apparent to me and to staffers and to the region that we need to expand our presence in that office to keep up with regional demands relative to service expectations there. We've grown so much that a 3-day presence in that office is not enough to satisfy regional demands. We need, or I feel we need, to have a 5-day presence there. What I am proposing to do is maintain our current QA/QI coordinator, Dean Romano, supplemented by an additional staffer that would work 2 6- or 7-hour days per week. I budgeted for 7 hours, 2 days a week. That would give us our 5-day-a-week presence in that office. I think that would work for us. I sincerely hope that that would work for us. What I would propose to do is post that, post it on the website. You could consider this in a formal announcement tonight to the delegates that are present tonight. Take home to your organizations. I'll accept resumes related to that. I can circulate job descriptions to anybody that would like to see a job description for that office. But that's the first edition there. Second edition actually goes hand in hand with that. Our front office person, Courtney, or administrative assistant, is actually swamped with work too. As the organization grows, it grows through each office here. I'm proposing the addition of a second administrative assistant. That administrative assistant will have a couple different tasks. I'm hoping him or her will be able to lighten Courtney's administrative workload somewhat, but in light of all the BLS Narcan administrative responsibilities that have been handed down to program agencies over the last year or so, a big chunk of that administrative assistant's job will be handling the BLS Narcan program for our region. To offset costs there, I applied for and did receive a $15,000 grant from the AIDS Institute for BLS Narcan costs. It's a grant. I also completed a second application, and I expect to receive another $15,000 grant sometime after the first of the year. Those would be used to offset the salary costs for that position. So those are our personnel expenses. There are a couple operational expenses I'd like to review with you. The first one is related to equipment. I'm proposing to increase the equipment line by $5,000, basically for this year and this year only as a one-shot expense. If you look around some of our EMS training equipment, you can't see the back room, but our equipment over the last several years has taken a beating, wear and tear-wise. We need to upgrade just soft goods, bandages, airways, stuff like that, as well as a few more hard goods. We need to expand our AED trainers and stuff like that. I believe everybody should have received a quote we solicited from Boundtree relative to those expenses. I think it's in the area of about $3,800, because I had Rich go back and add on about 4 or 5 cases of gloves. In any event, it's under $4,000, I know that, to increase or to purchase new training equipment. The second part of that increase is relative to a new office computer for QA/QI. Dean's had repeated problems with his computer over the last 6 or 8 months or so. It's been to the Apple Store, I think, twice now. It came with us from the old office. I believe it's probably about 4 years old or so. So I'm proposing to purchase a new office computer. That's lumped in with the training equipment. I budgeted $7,000. Realistically, I'm hoping to keep that at 6 or under. But I did put in a buffer there. Next line item is our medical director. The doc has been saddled with a lot of phone expenses. We do have a $5,000 expense account for our medical director. Phone expenses, just doing business for the region and the state, has eaten into the account that we've actually budgeted for actually doing work for the region. We propose to increase the medical director expense account by $1,800 to $6,800 to cover that. The last item, and it comes out of the executive board, is a $2,500 line item for an executive board retreat. We've never had one since I've been here, and I don't know when the last one was, but it came up to the executive board that probably now is a good time to have another one to review the direction the organization is headed, and then see what else we need to do to steer in the direction we want to see it go. So those are the proposed increases for this year's budget.
Any questions? Comments from anyone?
If you look, I'm sorry, if you look at the bottom, you'll see that puts us in the hole about $14,000, but bear in mind, that number will be basically negated by the Narcan grant to pay for the second assistant there, so it's not actually that big.
Any questions for Tim on the budget? There is one request made by the exec board that an additional line item be added to the budget to cover the employee incentive compensation that we have been handing out the last few years. So it's more visible in the budget for everyone. It's there to see. All right, the budget was approved, is the second motion from the executive board to approve it. So all those in favor?
Aye.
Opposed?
Like,
Move on to your next item.
well, what is that?
Incentive compensation.
Oh, I don't have a copy of the incentive compensation. Hopefully, everybody has a copy of the 2015 incentive compensation plan. That incentive compensation is a result of a plan developed by the board of directors going back 4 or 5 years ago. Kevin actually educated me. Initially, it was developed because the organization couldn't afford raises for the employees. Correct me if I'm wrong, Kevin.
That's correct.
But that's the way it was initially developed. It's pretty much morphed into compensation relative to what we generate revenue-wise annually. I think you all should have a copy of the formula. I can't recite the formula off the top of my head here, but I believe it was based on, was it $8,000? 8,000 and change there?
Well, it's 12% of the total profit.
Yeah, which was 8 something, right?
8,755.
And it's broke down percentage-wise for each position in the office. That's the incentive comp.
Any questions or comments about that? Okay. Motion to approve?
Aye.
Second for the motion?
Question?
Comments? Comments, questions, whatever?
On the outstanding course vouchers on here, is that the stuff that just got wiped off or no?
No.
This is
Those are-
what's
yes,
coming down the road?
yes.
Any other questions or comments? All those in favor?
Aye.
Opposed? policies and procedures, the new proposed policies and procedures. They were all emailed out to everyone, correct, Tim?
Yes, they went to the group.
Steve, you had some suggestions?
Yep. I had two amendments to make to the the harassment and sexual harassment policy, which we discussed in the executive board. Currently, in the section on response to complaint, it reads, the executive board shall appoint a conduct committee consisting of at least 3 persons. In the case of alleged sexual harassment, at least one of the committee members shall be a female. It's possible that an allegation could be brought against a person of either gender or brought by a person of either gender. So I would like to suggest a change to, in case of alleged sexual harassment, the conduct committee shall have both male and female committee members. So that's change number 1. Change number 2 is in the area of investigation. It currently reads, the members of the conduct committee to whom the complaint is referred will first attempt to resolve it in an informal manner by discussing it with the complainant and the person or persons against whom the complaint is lodged. I wish to add an additional sentence that says, under the guidance of Remo Legal Counsel. Or add additional clause to the end of the sentence that says, under the guidance of the Remo Legal Counsel, meaning that any mediation has to be done under the guidance of our attorney, since we do not have an HR staff person.
Any questions or comments about the other policies? Would you like to make your suggestion to the motion?
I'd like to make my suggestion as motion.
Second for the motion? Anne Marie, thank you. Any questions or comments on the motion? All those in favor? Opposed? Your bylaw change?
I bring forward a bylaw change proposal tonight for our discussion. According to the bylaws, it can be read tonight, but cannot be voted on tonight. It will then be brought up again at the next meeting, and the text of this bylaw change proposal will appear in the minutes so that it will be in writing. It has to do with the proposed article, it has to do with Article 4, which is the article that determines the executive board. I will first read what it reads currently, and then read the change. Currently it reads, thou shalt be an executive board with no more than 12 members to act on behalf of the council. B, the executive board shall consist of 5 officers, 1 member appointed by each of the 6 counties, and the regional medical director. I'm proposing 2 changes. One is changing the number 12 to 13. So it will now read, Section A, there shall be an executive board with no more than 13 members to act on behalf of the council. And then B, inserting the clause, the chair of the nurses committee. So it should now read, the executive board shall consist of the 5 officers, 1 member appointed by each of the 6 counties, the chair of the nurses committee, and the regional medical director. So that's been given to the secretary in writing, and there's no action on this tonight, but I do want to explain the purpose behind it. Our work with the hospitals continues to grow, and the hospitals have become an increasingly important part of our future. The emergency physicians are represented on the executive committee through the regional medical director, but the nurses committee, which is made up of representatives from all the hospitals, then has a representative in their chair. That position does not make it to the executive committee level, so that's why I'm proposing the amendment. We had talked about this last year, but we went about it we did not go about it through the proper means of amending the bylaws, so therefore it did not happen.
Okay. Any questions for Steve about that? All right. There's no other old business that I'm aware of, so items from the floor. Anything anyone would like to bring up tonight?
Yeah.
Yes, sir.
I have to tell you that I'm getting a sense that there's an awful lot of lack of transparency. We are a public organization, and we need to be about as transparent as we possibly can. There are 2 situations that concern me. One was tonight, going into executive session, asking some people to stay, letting other people go. It just wasn't handled appropriately. The other issue is that most of the time when you talk about correspondence, you say everything that want to read is here, so on and so forth, and it's listed in our minutes. I think we've had a couple of major oopses maybe left out of it, I don't know. Last month, you brought up a significant issue here, Remo, where we apparently had some issues with our training facility. I'm gonna guess that there were probably a lot of letters from the state on that. And I don't see anywhere where any of that was listed as correspondence. If we got statements of deficiency, I'm going to guess that they were probably sent to you in a letter. And none of that information was made public or even acknowledged that we got the letters. That should be routine and it should be open. To not let the council know about this information is probably not a good idea.
I did not personally receive any letters about it from the Department of Health,
I understand that.
and I did raise the issue up.
And the only reason we knew about it is because you brought it up. And so I just don't know how we can be getting correspondence from the state and it not show up as listed as correspondence from the state. That's kind of not good. I'm sure, did we get communication from the state in writing?
We had a statement of deficiencies, I thought I sent those out to you guys. I'm
There
pretty
was a
sure I
copy
sent
also
the executive.
sent to the council. There
Yeah.
was 2 copies, but I know who was CC'd on the bottom.
I don't remember hearing anything about it whatsoever coming out of this council. So,
I thought I addressed it at length last meeting.
no, you said we had some deficiencies. There was no indication that we got official letters, and there was, the mail and the information was not put forward, where normally the information is put up on the table, and if anybody wants to read it, it's available. That was not offered, it wasn't there.
I don't know, truthfully, I don't know if I got a letter, Jeff. I had the deficiencies, I can send you those. Can ask Mary if a letter was
There
generated.
was a letter sent out with the initial deficiencies. There was a letter that I actually hand-delivered. I do not know if the council received one, because I wasn't in charge of delivering that one. I hand-delivered you the letter with the plan of correction when that was
Yeah,
accepted,
yeah.
stating that it was accepted, but there was a 6-month probationary period.
Yep.
I just think we need to work as an organization to be very, very transparent. And it just doesn't appear that we're going that way. Essentially, our executive committee has turned into 3 less votes than needed, or 4 less votes than needed to run an entire meeting and pass business. When there's that many people together, I believe it should be an open meeting and very, very, very few things go into executive session. I just think we need to strive a little bit to make our business public. And,
The executive board meetings are open to the public. Any member of the council or anyone else who wants to come is more than
my
welcome.
suggestion is that we have a transcription made of our executive minutes. I think that would be a very good idea, because then it becomes official information as well. And this way, people can read that as well. If you go into executive session, then obviously that doesn't get recorded. But the reason why you want to go into executive session is recorded. And I think we need to have what goes on in the executive session made available to everybody.
Is that a motion?
Yes, it is.
Okay, second for the motion?
Wow, I feel like I'm hanging out here alone.
A second for Jeff's motion? Dave Bettini seconds, okay. Questions, comments from everyone?
Can you explain exactly what the motion means?
The motion, it means that we will have transcriptions done of the executive committee meetings, so that people can go back and read them, and people can reference them, and the information is documented for all to read. Because we have this meeting, and an awful lot of business is getting done in the executive meeting, and I think everybody should know about the business done.
Well, since this is a discussion, may I?
Absolutely.
I think that we have got a secretary, this is Wynn's first year as secretary, but we have 2 full pages of minutes from the last executive committee meeting that were passed and adopted. In addition, the meeting is open to everybody, and a number of people here regularly attend that meeting, but everybody is available too. I don't know that we need to I don't think that we are not transparent when we go into executive session. The time we go in is documented, and the reason we go in is documented. And as you said, if it's an executive session, that would not be transcribed. I'm not sure having, with all due respect to our transcriber, who probably love that extra work, I don't know that, you know, we're adding anything by having a word-by-word transcription of that.
Because then we have everything and just not a recollect from minutes. I think we can afford it. We have damn near $500,000 in the bank. So I think we can afford it. And the reality is, I think it would be really good business if it were made public. It is a public meeting, and we should have a way for people to access the information. I just kind of think that we need to make sure we operate very, very open. I get the feeling that the only reason that the deficiencies from the state were noted is because Kevin brought it up. And I think that what we heard in the executive meeting last month versus what was heard out here was two entirely different descriptions of the deficiencies. And I just think that we need to document what goes on in the executive meeting. And as I said, it probably is not that much more to add to it, and I think we can afford it.
Lynn?
Do you think, have you had the opportunity to read I am quite comprehensive.
Are
in
they
my
published to everybody? Are they handed out to everybody? Is there information available? Do we have to request it? It should be it should be sent out to everybody.
Well, that's different.
Both the
I'm just-
minutes of this meeting and the minutes of the executive meeting typed up, and not minutes, but transcriptions of them. And they should routinely be sent out to all the members by email.
Mike?
I guess I just have a question, Jeff, of what your issue was with going into executive session tonight based on a specific personnel issue that was related to one person.
And asking other non-members to say, you can stay, but it's
Nobody,
not on the executive
nobody else
committee.
stated other than the officers. The
Because
only
you said
person
no,
that we
thank
asked to
you.
come in was Tim, because we tasked him 3 months ago to address this specific issue.
It isn't just tonight, it's last month
But
as well.
you mentioned tonight, so I want to know
And I
what you
mentioned
thought
last
was done
month as well.
inappropriately by the executive board with going into executive session.
I'm pretty upset about last month and not knowing about the deficiencies, nothing, no mail published, and thank you for Kevin, and I really appreciate you bringing that up. So, I just think that.
You're not the only one that was upset about that, because it's just not Kevin that didn't know about the deficiencies, it's the
My-
majority of the executive board as well, so, and that's been addressed.
Am I wrong in saying that it was two different descriptions of what transpired, one in the executive meeting and one out here? And I really think we
I don't
need.
think so.
No.
I don't think so.
I disagree
I think in the executive board, we spent a lot of time trying to figure out a complicated set of occurrences so that they were explainable.
I think it might be also an advantage to actually have the executive board review open meeting law, how it pertains to Remo. When you have a closed meeting like that, it may be a violation of that.
But how is it a closed meeting when it's open to the membership, it's open to the public? Anyone is welcome to come in that door. The only time they're not
You may have
welcome
to
is when
review
we're in
that.
executive
You have to
session.
review that, make sure
Which,
it's-
to the best of my recollection, tonight was the first executive session that I oversaw this entire year.
Just make sure you review
Kevin,
that.
didn't even know you were gonna do executive session tonight, and I was gonna bring this up anyway.
I didn't honestly know I was going to until it was asked for.
But I sat, as a member, I sat in the executive board meetings for 3 years before I became a member of the executive board, did I not? I was a council member, and I went to all of the executive board meetings. And the only times I had to leave was when it was executive session.
Is there a problem with having a transcript of it?
I think the suggestion that we review the open meetings law is a good one, because we could all be sure that we're doing it right. I think the suggestion that the minutes of the executive committee be distributed to everybody, not just the executive committee, is also a very good suggestion. I don't, with the regular Remsco minutes.
A lot of things this organization does within state law, state governance, is to make sure they're actually doing our job to our constituents and abide by state law.
just wondered if I did something wrong with the meeting minutes.
No, it has nothing to do with the meeting, it's nothing at all. I just think we need an exact transcript, so people can read what was said, not what the recollection of what was said. And that's clearly sometimes different, and not intended to not be accurate, it just isn't. And that's why I think a transcript is important.
Any other questions or comments?
Good. This may be a past practice thing too, but probably something that we should consider is the executive committee may want to re-look at what you guys do and why you do it in the committee setting. I don't think there's anybody who's sitting here that doesn't appreciate the fact that the actual council meeting has been somewhat brief and we're all able to get home in a timely fashion. But much of what, and I'm saying this from someone who attends the executive committee meetings, much of what is discussed in there is not anything that could not be discussed here, and maybe to address not only what Jeff alluded to, but what was described in terms of complying with state regulation. It may make sense to, short of personnel issues or something of a exclusively sensitive nature, or where the executive board is working on something unique to, you know, a process that would be too time consuming to discuss at a regular meeting, maybe we should all suck it up and this meeting should last 50 minutes as opposed to 30 minutes, and none of these issues would be issues, because it's all discussed at that one time. Again, may just be past practice that we don't need to continue.
Any other comments or questions? Seeing none, all those in favor of the motion? I think probably a show of hands would be best.
What exactly could you just?
The motion is that we have a stenographic record of our executive meetings. That's period. And it get published monthly along with the minutes that they already recorded. Just in addition, so everybody can read it and know what's going on.
Thank you, sir. All those in favor? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Opposed? 1, 2, 3, 4, 5, 6, 7, 8, 9. And I'm going to abstain. So 11 in favor, 9 opposed, 1 abstention. Dave, correct my memory, please. Do we need a majority of the council, or just a majority for something like this?
The majority of those present and voting.
So we have 21. That would be a majority. Okay. Okay, motion passes. Okay, any other items from the floor? Seeing none, motion to adjourn?
So moved.
Thank you, everyone.
No, I was waiting for my.